Why are we here? Well, we all have our individual motivations, but at least in terms of Wilder Research hosting this conference and participating in work related to this topic, part of the explanation is on the graph right behind me. And what you see there is something we developed in a project for Blue Cross Blue Shield of Minnesota Foundation. And it shows that if you drive along Highway 94, you go through neighborhoods that have very different life expectancy. Your chance of living is very different depending on where you live. And that's derived from something that we're all familiar with, the social determinants of health. And we all recognize how important they are. And these numbers demonstrate their importance, that living in one neighborhood can literally mean living several years longer than living in another neighborhood. There's another way to look at it that we sometimes show, and that breaks out life expectancy by race and ethnicity. And this particular graph refers just to the 7-county Twin Cities metropolitan region. And here you can see very different life expectancies depending on your race and ethnicity. So compare numbers like 61.5 or 74.4 at the bottom to 81 and 83. You're talking about 8, 9, 20 or so years difference. If I were to ask you right now, you know, could you add on 8 days or 8 weeks to your life at the end of your life? You might say, well, that's a long time into the future. But if I were to say, well, do you want to add on 8 more years or 20 more years? That would probably make a big difference no matter how old you are right now. And these kind of numbers reflect the social determinants of health. Another way of breaking them out, this chart shows mortality rates, again based on race and ethnicity. And any of these numbers, don't worry about writing them down. You can get them on our website later. But I'm trying to illustrate certain patterns that demonstrate the importance of these social factors for all of our lives. This particular graph takes that place data, that neighborhood data, and compares neighborhoods based on income, but also subdivides based on racial characteristics. And there's good news and I suppose bad news in the graph. The good news is, if we work on the social determinants of health, we potentially can make a real difference. As you see here, the higher the income level of the neighborhood, the lower the mortality rates. The bad news is that even once we improve economics, there are still differences based on race. So there's other social determinants that we'll need to address if we really want to achieve equity. That's the reason we've gotten involved, and that's, I think, the reason why many of you have gotten involved in this as well. But we're not just studying the problem, we're very much interested in solutions. And in moving towards solutions, we were energized by the national level project that was developed by the Robert Wood Johnson Foundation and the Federal Reserve Bank, in which they were encouraging communities to come together around this topic, to have community development organizations and health and human service organizations learn about this topic and move on to action. And some people in this room have been very active across the nation in local level conferences that have been sponsored as a result of this initiative. And you'll hear from a couple of them later on. For example, Elaine Arkin from Robert Wood Johnson, and David Erickson from the Federal Reserve in San Francisco. So that's why we're in it. We're focusing on solutions. The first conference, which some of you attended, was inspired, as I said, by this national movement. And what we tried to do was to bring together the different sectors, community development, health and human services, and we wanted a meeting of the minds. We wanted them to explore the topic, to become aware of what it involves. We had sessions in which we were trying to get each sector to understand the vocabulary of the other. What are their goals? How do they do their work? How can I best work with them? And we tried to get people from throughout the state just to meet one another, meet around common topics, meet around common issues, meet around common regions that they wanted to serve. So we did that a year ago. And now we're following up with meeting 2, 2013. And we're trying to push that solution ball you saw in the previous slide. We're trying to show what is working or potentially working, has a good chance of working here in Minnesota. How can we showcase it? How can we let everyone know about it? How can we continue that interaction among the different sectors? Because people are working in parallel to change those numbers that you saw in the very first graph, the different neighborhoods along I-94. They've been working in parallel to do that, from community development, from finance, from health, public health, from human services, education. They've been attempting to do that, but they've been very much working in parallel. They haven't come together necessarily for the meeting of the minds, but it's starting. It actually a little bit was starting before the conference last year. Already Minnesota was being noted for the activity occurring here. Last year's conference hopefully stimulated and nurtured more of this, and we hope that this year's conference even does more of the same.